All right, welcome everybody to our CHW Empowerment Coalition of Maryland meeting. So for this meeting, we're coming out of legislative session about 5 days out. So legislative session ended last week. And what we thought we could do today is number one, provide an update on the outcome of the CHW Appreciation Day bill, debrief on how we think the session went, what went well, what could go better next year, and also reflect on what our next steps should be now that we, um, started to put our name out there as a coalition and have started to identify who our allies are. So before we get into those parts, let's talk about the bill a bit. So I'm not sure if everybody has received this update yet. I don't consider it, bad news. I think that we had a huge milestone this year getting the bill out of the House. But unfortunately, the Senate committee, after they heard the bill, they didn't prioritize it to take a vote. So it didn't get down to the floor in time to pass and go to the governor's desk. So we did not get the bill passed this year fully, but we did pass it in the House, which I think, that is a huge milestone for our coalition, right? I just want to put this in context a bit because, I don't know about other folks, but I tend to be very hard on myself around legislative losses sometimes, and I think it's important to put those into context. So one, commemorative day bills, typically the legislature passes maybe one of those a year, sometimes none. Um, we were told by Chair Pena Melnick, and please don't let this leave this coalition meeting. But we were told by Chair Pena Melnick, as we were meeting with legislators, and then some of us met with her, that the committee more than likely was not going to pass the bill. In fact, she had let us know they weren't going to, this was in the House, that they weren't going to pass it because they passed so few commemorative day bills. And she had asked, this coalition, why is this bill so important? And folks who were in attendance at that meeting did such a wonderful job really making the case for why CHWs need public recognition and appreciation for the work they do. I really believe that that meeting, in addition to the strong, like really strong turnout of oral testimony and written testimony, we had a huge wave of written testimony for this bill in support, including the MDH supported the bill, which was a huge surprise because they didn't let us know in advance that they'd be doing that. And typically the department, well, actually, before I say that, let me finish my first thought. But she had told us originally that they were not going to pass the bill. But after that really strong hearing, she and her committee members, for folks who watched the voting, said it's the right thing to do to pass this bill. So that's huge that we were able to get this out of the House, that we now know we have allies in the House and that we have allies in high places in the House. Delegate Bagnall, who was our lead sponsor, is the chair of the Minority Health and Disparities Committee. And Chair Pena Melnick is the chair of the whole committee who makes the magic happen. So that's incredible. The next thing I'll say is that, finish wrapping up on what I said earlier, MDH came out in support of the CHW Appreciation Day bill. Typically, the state agencies don't take a position on bills like this. Usually they might submit a letter of information where they're not taking a position either way that says something like, Maryland has a CHW workforce. This is how many people are part of it. We have certification, since this year. And then that would be the end of it. But they came out in really strong support of the bill, which is great. So we know that we have the department as an ally on CHWs. And so next stage was going to the Senate, and we were in the committee's called EHE. I might get the name wrong. Someone correct me if I'm wrong. I think it's Energy, Environment, and Health, maybe Education and Health. But anyway, that committee was the one that received the bill, and I know for PJC, that's our Health and Benefits Project isn't typically in front of that committee. But we did do our best to try to meet with folks on the committee, educate them on what the bill would do, why it's so important. Um, Many of us ran around the legislature handing out hard copies of the invites to the rally so that they know that was happening and, have that personal touch in attending. But because of the timing in session, our bill was heard in, it was March, right, David?
Mhm.
March 14th?
Yes.
Okay. The bill was heard March 14th, which gave us, I think, a week or two before it had to go across the street from the House to the Senate. So we made that deadline. But for it to be to get down to the floor, um, we had about, I think we had a week or two after the hearing to get it down to the floor before the deadline that they would be voting on bills. And unfortunately, this one wasn't prioritized on the Senate side because, I mean, they had a lot of other bills, but they just didn't prioritize this one. So, all of that said, I think it's still a win for our coalition that, let me stop talking because I think maybe we should, let's debrief as a group and talk about, maybe the positives and then maybe things that we could do differently next year. But David, did you have anything that you wanted to add?
Um, the only thing I would add to that is that another huge win that came out of this for us is the visibility of this coalition. And I've had a lot of individual community health workers and other folks that reached out to me in the run up to the rally itself and the legislative session, and we've gotten more engagement since then. So I don't want to understate how important that is for us to accomplish our goals next year. I mean, we set out to do an education bill, and I think that we accomplished that goal. So yeah, I just wanted to make note that like as a tool for visibility and education and accomplishing those goals that we set, I think it was a big success.
Yeah, thank you for sharing that. I think that's really important to put into perspective. I'd love to hear from others, thoughts about the outcome on the bill. Um, what do you think our wins were this legislative session? What do you think that we could do differently, or what do you think, maybe held us back a bit from getting the bill through?
This is Dwan. How's everybody doing?
Good. How are you?
Good. So just I kind of came in a little late. Just want to clarify. So it went through the House, but it didn't make it to the Senate. So we're gonna have to try next year, correct? To get the
Yes.
bill done. Okay.
Yeah, so it passed the House, which was
Right.
a huge win because we were told in advance that they more than likely were not going to pass it, but they said it
Mm.
was, quote, the right thing to do. In the Senate, I really do believe this came down to the timing of the hearing. There wasn't enough time for them they had so many bills they were hearing and had to vote on, and this one just didn't get prioritized in the Senate. So it didn't pass the Senate.
So what gets prior? How do you get prioritized? What is the key to getting it prioritized? I think
Yeah.
we as a coalition, it kind of ramped up a little quickly because some people still weren't aware of what was happening in the coalition. So I think having time next year to build more of the coalition, to have a stronger understanding of what needs to happen, I think that's fine. The same thing happened when we went in for certification. Same thing. Um,
Mhm.
because when we went the first time, a lot of people didn't know about CHW. So again, I think a part of the role of the coalition was to kind of get it out there, get people to understanding who weren't familiar. Um, we had the rally. I think we need to do another rally again.
Yeah.
But I think we need to do it in conjunction with when and also figure out on the Senate side who we need to bring in as we move forward to push for next year. And
Yeah.
again, we did the similar same thing with the certification bill. We actually had some of the members come to the association meetings to speak to other CHWs around Maryland. Um, and I think again with this coalition, we need to really reach out more to more CHWs and really drill down to the benefits of having this advocacy voice and what it really means. Yes, CHWs needs appreciation, but we also have to understand the underlying issue is not just appreciation. It's once we get that, then how does that support us as a workforce and getting things like benefits, good salaries, proper training, and workforce support? So I think that should be more on the platform. And I'm not sure if the Senate is aware of those other things. So
Yeah.
that's just my little 2 cents.
Yeah, I really appreciate all of that. And I think that those are excellent points. You know, you're right, we ramped up as a coalition very quickly, which we had an excellent, I don't know if everybody's aware that our attendance for the rally or our first ever coalition rally was about 50 people between virtual and in person, which is really great for a first year rally. Um, and I agree with you that we do need to keep that going, keep having rallies annually. And you're right that on the Senate side, I know when David and I were kind of looking at like who are our allies on the Senate side, we reached out to quite a few people to ask them to sponsor the bill on the Senate side. And we weren't able to find someone to take it on. I think part of that was the timing because it was right before the holidays. But I think the other part of that was that we need to do some education on the Senate side, some more education. You know, originally we thought that this bill would end up in Senate Finance, so those were the folks that we reached out to ask to be sponsors, and it didn't. It ended up in a different committee. So we need to get to know those committee members because a bill for reimbursement may go to their committee again, or it might go to Senate Finance and EHE jointly next year. So
Gotcha.
that's something to think about. And I keep hiding the ball on this part, but another win that came out of this session, like I said, we identified our allies on the House side, but Chair Pena-Melnick told us that she really appreciates the work that CHWs do. She strongly believes that they should be reimbursed for their work, and she wants to pull together stakeholders this summer to start talking about putting forward a reimbursement bill next year.
Oh, awesome.
Yeah, so that's huge. That is huge for our group. And we're trying to schedule that with her now. So we wanted to wait until session ended to reach out to her to say, can we get on your calendar? It sounds like she's serious about convening this kind of meeting because she also talked about inviting the Department of Health.
That's great. So I think we're moving along with how we should be because this is the process. You know, when you talk about grassroots, you know, coalition building, a lot of people are just like there's like 100 or so grassroots coalition building groups, and I guess they have to decide, you know, politically, which sucks, what's going to better serve them. But I think we're in a good position now to really come next year hopefully having a sponsorship in the Senate. And I know former Delegate Lamb, I know he's running for Congress or something. I don't know if any of his pool could be pulled back in to at least help us get endorsed or his name, or he can talk to some of who's on the Senate, him. And I know Delegate Shirley at the Pulliam is retired, but her word speaks volumes. So I don't know if we need to bring in some of our legacy, you know, from our advocacy days to really kind of speak to the new leadership in office to help us as well. I don't know if that can help us too.
I think that can help us. I think, we should as we get closer to the next legislative session, we should take some time to think about, who do we need to reach out to this summer to start conversations that's in a position to sponsor the bill. I think on the House side, pretty clearly that Delegate Bagnall, she's expressed that she really wants to be a champion on advocating for CHWs in the legislature. So I think we have our champion there, and also Delegate Robin Lewis. But on the Senate side, we do need to identify someone in the case that Senator Lamb is not available. I very selfishly want him to not win the race so that he stays in Maryland as
No,
our.
I want him to win the race because then he can start from Maryland and go to the federal. So either way, I think it's going to be good.
That's true. It's nice to have allies in the committees, though, but don't tell him I said that. That's
We need people in higher places.
I'd still vote for him. But yeah, so I think those are great points. And then did anybody else want to share what they think our wins this session are, or how we could work to, build off of this year?
This is Stephanie. I'm in one thing that I'm in total agreement of expanding the coalition in terms of the CHW, and I've been trying to think and come up with ways of recruiting. I guess that's the word I want to use. I mean, I talk to a lot of them, and they say they're interested, but I need to find. I'm trying to find the niche to make to turn it from maybe to a yes. So I'm trying to see what can we do as a coalition to advertise. I guess that's what I want to say. Advertise for us to draw in more CHWs because we are, if this is about us, it needs to be us there in the midst. So that's what that's my thing. I just want to bring more than just the handful that we have now. You know, we need the voice of a CHWs.
Yes, I totally agree. I think maybe I think that's a great conversation to have in our the outreach and engagement subcommittee. So now that session is over, I think we should get that booted back up. Because there are a lot of things happening, like events coming up that center around CHWs where maybe some of our allies might be willing to let us do something like table at those events or have some materials about the coalition available, since those events are probably going to draw a lot of Maryland CHW workforce.
Yeah, we have IPHI, we have a conference every year for DC, Maryland, and Virginia, but definitely you guys can definitely be there to get people to sign up and maybe speak about because we always want to include what advocacy is happening around CHWs. And I think it's a good idea because DC is looking at certification in a funky way. And so this could be a dual type of situation where we can talk about what's happening in Maryland and maybe get more CHWs through that, but also to let DC know also, what's happening in Maryland and Virginia, certification, recognition, and things like that, and the role that CHWs play and how important it is for things as far as, they're looking at mandatory. DC is looking at mandatory certification, which is going to change the game for us as far as reciprocity. I've been on the reciprocity committee for the past few years with Tina MDH, and that's going to put a big monkey wrench in that process, so those types of things. Yeah, but I think also understanding that CHWs work a lot during the daytime. So attending these meetings is probably not feasible. So we could send out the recordings to a listserv of CHWs, a newsletter, or at least have one evening meeting, opposite a day meeting, or move the meetings to maybe a Saturday or evening time, or something that CHWs will be available. I think the availability, because we've always had challenges with the association and other committees of getting CHWs, but like their managers and supervisors want them in the field, and they don't see this as a part of their work, which it should be, but still they don't see this as a part of the work that CHWs need to be involved in. even though it's supporting the workforce, is organizations about getting their numbers and meeting their grant funders, and not necessarily supporting CHWs to advocate like they should be, and like they should be supported, as this is a part of their role, and understanding how to advocate for their workforce. So it may be also talking to their employers to get them to be somewhat allies and champions of getting them to encourage their CHWs to be a part of this as well. So I think we have to look at it from both of those sides. And these are challenges that I've seen and been through, trying to start an association back in the day when I was a CHW, and what we've been through not too long ago, what's happening around the country.
Yeah, I think it's an incredibly important point, and it's something that I've been thinking about a lot too. Like as an organizer, I run into this conflict a lot. Some of the people that you need to talk to about, administration and policy are not available at the same time as folks that are, working an actual job. So I don't. One thing I was thinking about, we had talked about working through providing a legislative training, which I don't think we had the capacity to do in the run up to the actual rally. But I would love to do something like that, because one other obstacle might be that a lot of CHWs might be excited about this coalition and like believe that it applies to them and that it would benefit them, but they might not know like what to do or where to start in terms of getting involved. And like I know we had some written testimony on the bill from Healthcare for the Homeless, where a couple of their CHWs wrote some testimony. So maybe if it was just something like doing a legislative training so that people are more comfortable in the process and are confident that like they have a voice and they have something to say, is another thing that we might address. But yeah, I would love to brainstorm in that outreach subcommittee more ways to engage with folks that are working in 9 to 5. So if you had to do an evening training, we can.
Sorry, David.
No, go ahead.
Also, the CHWs who are certified through Maryland are through One Stop Maryland. Is that what it's called, Dewan? But they send out like a newsletter quarterly. But maybe getting something in that newsletter to reach the people who are
it just came out today.
big hospitals.
Right.
Yeah.
That just came out today too. I don't know if that's
It did. That's why I thought about it.
Yeah.
Is that the one through? Is it through MDH? Because I got something today.
Yep, that's it. It just came out today, and it's because it's in English and Spanish.
Yes. Okay, I saw that today. So we can reach out to Tina Baki. I see that she's the contact on this. They're doing a survey to build community health worker workforce profile. But we could reach out to Tina to see if maybe we can get something in the newsletter. I think part of the strength of this coalition, a strength that we're finding is that because, number one, we're not a union, so we're not a threat to anybody. Not that unions are, well, they're threats to folks that don't want folks to unionize, but we're not a union, but we also, because we're not standing in opposition to the state, we have a lot of allies in state agencies that I think that we can ask them, can you share this with your many listservs and networks? Because I assume they have a way to reach all certified CHWs in Maryland. And because they came out in support of this bill and they sound, generally supportive about working towards reimbursement, that's a great position to be in. And just to clarify what I was saying about unions, I think unions are great. I was just saying, because this isn't a union space, we don't have to worry about, about whether or not we have allies in places like state agencies. We definitely have those allies. So I was gonna say, maybe let me see what our I think this has been a really rich conversation so far. I did want to go back a bit to are there things that well, it sounds like we talked about what the hurdles were this year. One was timing, not having a Senate cross file for the bill, and continuing to build momentum and build membership in this coalition. I guess, David, do you have thoughts on, is there anything that we missed in that discussion?
Not that I can think of. I'm just really thinking about, ways that we can engage more practicing CHWs, because it is very important to me, not just because it's the right thing to do to center their voice, but strategically, it's really important that we've got that engagement. But yeah, I don't know, so far so good. I don't think I have anything else to add.
Great. So I guess the next thing we can talk about then is, so we know that MDH is working on this study on CHW reimbursement. We had reached out to Ryan Moran, the Medicaid director, months ago about getting a meeting set up for the coalition. Hadn't heard back. Then the legislative session started, and we did run into him on the day of a different bill hearing, to kind of remind him that we're waiting to hear from him. And he was like, seems like I know many of you know him. He seems like a very genuine person. He was like, "Oh, I'm so sorry. There were 700 bills this year that required Medicaid to do a variety of things. So they have just been so overwhelmed at MDH and at Medicaid. Or I'm sorry, that required MDH to do and Medicaid to do a variety of things. So they've been really overwhelmed. But he said as soon as session is over, to circle back to him so we can get something on the calendar, because like they just needed to get through session. So we can go ahead and do that now. But the other thing is, with Chair Pena Melnick, since she's interested in meeting this summer, another big step that we need to start kind of building out is talking about a financing plan around CHW reimbursement. And what are we proposing that the state do, and how could they cover these services? We do have some allies that have reached out to us that Dave and I met with. Dr. Hold on a second. If you have his name in front of you, David, see, was Dr. Panagis Galiasados, from Hopkins. I'm not sure if I pronounce his last. I know he goes by Dr. G.
I was about to say, we all call him Dr. G. He is a lovely
okay.
man.
All right, awesome. So we had a great conversation with him a couple weeks ago, because he's so savvy on CHW financing and what other states are doing, and kind of a national view of the landscape around reimbursement. And he also shared some new changes that have happened, well, not new, but recent changes that have happened with CMS in requiring hospitals to do social determinants of health screenings and sort of building CHWs into that work. And he had expressed a lot of concern that if the financing piece for CHWs in Maryland isn't figured out soon, hospitals may just move forward in figuring out how to do these types of screenings and the work that they're being required to do unfunded from CMS without relying on CHWs or having a CHW workforce. And we don't want that to happen.
Actually, I can kind of speak just a little bit about that, because that's actually what I'm doing. And I know Dr. G too. So and I'm working on that. Yeah, I'm working on that CMS. Goodness gracious, I just lost it. But anyway, I'm working on that project at Bayview. And CMS did not give hospitals any funds for this. So the hospitals had to come up with the money on their own to hire the CHWs. So yeah, that was one of so it's been like, even with me, there's two of us here at Bayview. They wanted three, but right now they just couldn't have the money to get that third person. So it's just the two of us. So, and that's been what's going on. I know within Hopkins, the various Hopkins hospitals in Maryland, that's been a thing of, funding for this position because CMS didn't allot anything for it. They just told hospitals, this is what we want you to do. You have to do it, and that's it.
Yeah.
Yeah.
Chinema.
Yes, thank you. Hi, everyone. Yeah, really, I, it's been great hearing all of the progress that has been made in terms of connections and different people who are aware of what's going on a national level. And there are a couple of things that came to mind. The first being that we talk a lot about Medicaid reimbursement, which I think is really essential. But I also want to just propose that we also think really carefully about advocating on a general level about sustainable financing for community health workers, not only Medicaid, but other types of financial arrangements. And I say this because nationally, most community health workers are actually not based in healthcare settings or academic institutions. They're based in community-based organizations, and trying to figure out how to ensure that CHWs who are in community or in CBOs or other types of, like similar entities, how they can have sustainable financing, I think really needs to be we should bring it to the forefront. So even though, from a legislative perspective, what we should be advocating for is Medicaid reimbursement. I think I've said this before, but what are they reimbursing? Are they reimbursing low wages? Are they reimbursing, you know, um, kind of like the status quo when it comes to healthcare and public health delivery? Or are we priming the state Medicaid to think more carefully about addressing social determinants of health and ensuring that the full range of services that CHWs provide are sustained financially, whether through Medicaid or through some other mechanism? And I appreciate the point that Monica raised in the chat that Denver's CHW programs are based in CBOs. And I think the same actually applies in North Carolina and in other states too. So again, I think it's great to have the goal of Medicaid reimbursement, but I think it really needs to be contextualized as one piece of a broader strategy to support community health workers financially. And then the other thing I wanted to mention is that Panagis and I talked like a few months ago, I think either right before or after the holidays. And I really am curious to know who is conducting this study on the community health worker workforce, because I do remember proposing that in the ABLE Foundation report. And in that report, I guess what I was really trying to do is to lay out the steps that people may need to consider in making the case for sustainable financing. And I don't really know if the state health department has the bandwidth to conduct the kind of study that might be necessary to, shed light on what's happening in the state and across the country and pulling all of those things together. I will just say very frankly that even for the ABLE report, it took me a full year to do a really comprehensive appraisal of what's happening on the ground. And even then, I'm sure I missed major things. And so I'm curious to know who is working on that, and if there would be an opportunity for some of us who are allies of CHWs and trained in research to take some of that on. So I just wanted to bring that up as well, but I don't mean to keep talking. I just really wanted to make sure I, shared some of my thoughts regarding what we're discussing. Oh, and side note, do you see my bag, the coalition bag behind me?
Yay! Yeah,
From the rally.
yeah, it's like carrying mine around too. Just about to.
I
Yeah.
actually even picked up extra bags to give to friends.
Oh, great. Awesome. Awesome. And yes, everybody who's on the line, please don't forget we've got a lot of coalition branded stuff now. So you ever stop by the PJC office, please I'll let our office manager know, like if anybody stops by to get coalition swag, to go ahead and like give you guys the stuff.
Where are you guys located?
We're on 201 North Charles Street in
Okay.
Baltimore. Yeah. And so to Chidima, thank you so much for sort of regrounding us in the reimbursement discussion. I know as we've started out, we've talked about, it's both Medicaid and looking for financially sustainable pathways that would cover folks that don't qualify for Medicaid, because it's not just Medicaid beneficiaries that need access to CHWs, and CHWs aren't just working with Medicaid beneficiaries. They're also working with Maryland's immigrant communities as well, who might be coming from mixed status families. And so I appreciate you and regrounding us in that. And I think, coming off a legislative session, it gets easy to fall back into the, okay, so we talked to the Medicaid director, we got to talk to the Medicaid director, but Medicaid, like you said, is one piece of this, and we need to think about who else needs to be part of this conversation and developing the strategy outside of Medicaid, because ultimately, and we can talk to the to MDH and to the Medicaid director, but ultimately, what they would propose would be for Medicaid beneficiaries. I think we can assume that, and that's what the study, just reading the language, that's what it looks like it's limited to, is Medicaid funded settings. So who else, thinking about who else do we bring into these conversations to talk about funding outside of that more narrow system. And then the last thing I was going to say was, this was all building up to say that when we talk to Paniki's about about financing, what's going on with CMS, we thought that it would be good for this coalition to have a subcommittee specifically dedicated to talking about CHW financing and starting to develop a plan. So if we bring together folks who want to discuss that piece of things, I don't think it's, when I join coalitions, there's a bunch of subcommittees. I look for the things that I'm most excited about. So, and I think talking about, the funding stream might not be super exciting for everyone, which is why we thought putting that conversation in a subcommittee would make a lot of sense. And just wanted to share that with folks so that anybody who'd like to be part of those conversations, please let me know. Tentatively, the meeting schedule that we've set for those is every 2 weeks, because we want to start getting moving and making some momentum on, coming up with something that looks like a, not a proposal, but a sort of plan / recommendations for how the state could proceed, to share with Chair Pena Melnick as she's thinking about, working on CHW reimbursement. So tentatively, our meeting schedule is it's every 2 weeks on Tuesdays at 9. I'm not sure if that will work for everyone that wants to join, but if you do want to join, let me know, because then we can maybe send out a group email to figure out if there's a different time that we could set those to. And I see Monica has her hand up.
Good afternoon, everyone. Thank you so much, Ashley. So I was typing down what I wanted to say before I forget. I agree with Dr. Ibe about the funding sources, funding streams for the community health worker workforce. I think something that we could consider in this coalition is the lessons learned from the Healthcare for All bill. As you know, 3 years ago, that bill was introduced, and I don't remember who was a champion back then, trying to provide the Medicaid extension for all, so that regardless of immigration status, anyone could get primary care. It was not passed. It got a lot of pushback from the legislators, and one of the main reasons they gave was the cost. So learning from there were some policymakers that recommended to do a review of that and make a cost analysis and present it in a different way and break it down into small pieces. So one of them was the Healthy Babies Act that was sort of presented at the same time, and one didn't pass and the other one passed with amendments the following year. Then this year, the same advocates for the healthcare for all presented a new bill that's gonna sort of like in lieu of the healthcare for all bill to just allow uninsured individuals, regardless of immigration status, to purchase healthcare insurance through the marketplace. So I think it will be great to have a conversation around what are the pieces of the big thing, of the big picture that we want to accomplish as a coalition, and start presenting those as the small pieces. Because I think my sense, and I'm not a policy expert, but my sense is that when we come with a big legislation that could be rejected entirely if there are any costs associated. And my understanding from this year, for example, there were a lot of bills that were not passed if they had any cost for the state. So just something to consider, especially if we want to be inclusive of populations that don't have or don't qualify for Medicaid. The state of Maryland is still not Medicaid extension doesn't cover everybody yet, and that's sort of like what we're trying to do. And if we're gonna advocate for Medicaid to cover community health or reimburse for community health worker work, there's still a large population that is left out. Just today, I was reviewing some percentages of demographics, and the immigrant population has increased a lot in the past decade. So yeah, I think I'm talking too much. I just wanted to bring it up. It's great to have like the big picture and broad goals for the community health worker, but it will be great if we can start breaking it down into bullet points and then taking each small piece into one separate bill, and then win, divide and conquer, I guess.
And I think that's I keep saying this today, and I feel like every time I come to these meetings, it's such amazing ideas. So I'm just like, that's a great idea. But I agree with you. I think, and we've seen that too, where a bill that's very comprehensive can be really, really expensive. And then it's kind of shot down or not taken as seriously because it's very high in the sky. And so even if staggering out time frames for things could help. So it might be that maybe next year the state submits a state plan amendment to cover CHWs in Medicaid funded settings, but then maybe the same bill says that in the following year, the state shall develop a fund or something to support reimbursement in other settings. I don't know. We can talk more about that. And I think it's important as part of a first meeting for that subcommittee to really sit down and think, who are the folks that we want to make sure can access CHWs, and what, and are they, if they're not insured, what avenues exist to support them in being able to access a CHW? Because we know that, many of the settings, I think part of that is thinking about where do folks access care? And, is it a matter of funding positions in, for example, FQHCs? I don't know. I'm getting off track, but I'm just saying there's a lot to think about here in terms of, what a proposal could look like. And I agree with you that if we put too much at once, we either may not get any of it, or we might get a very small part of it. So it's important to put forward legislative efforts in manageable chunks. And on average, it can take a bill about 2 to 3 years to pass. So usually like 2 or 3 years of being introduced before it finally passes. So just keeping that in mind too.
Can I add one more thing?
Yeah.
One more thing, Ashley, sorry. So sometimes I hear more and more, and the literature actually says too, that the Medicaid is usually taken as as you know, the source, the funding source for healthcare. However, I have read some things about the DPP program, for example, that the reimbursement covers the program, but that 1 hour session that you have with your patient is actually not enough for the whole program. You know, the follow-up, the engagement, the logistical things, administrative stuff. Like, it is my understanding, and I may be wrong, but I think I read something, a report or a paper that was talking about it. Medicaid only covers the cost of that 1 hour encounter of DPP. So then programs end up in a situation where they have to get their reimbursement for that 1 hour session of DPP, and they have to fundraise separately to cover administrative costs, logistical costs, site costs, materials costs that are not reimbursed by DPP. So I think that can also be considered when working for the work group, to consider on how they are going to present it as a solution that Medicaid is going to address. Because if they go and use the DPP as an example, because it's happening, like they do reimburse for DPP. DPP is a diabetes prevention program through Medicaid. If they use that as an example, they can say this program works perfectly fine. So we're going to do the same thing we do for Medicaid, and then we'll end up underfunded, which is a step. Right now we don't have anything, but I don't think it's enough, and I don't think it's ideal. So just to consider too.
Thank you. And I see your comment in the chat, Leslie, about potentially having a financing work group to come up with a plan before a bill is passed. It is possible that we may have to, I think ideally, because we know that this study is coming and that the report is supposed to be published in December. We know that Ryan Moran has also said that he's interested in potentially just, moving forward on reimbursing without having to have legislation. It's possible that a work group might be needed. We don't know yet if MDH is going to be requesting that a work group be developed to further study or make recommendations. I was kind of looking at the study sort of as the work, not work group, but as the work being done on thinking about the financing piece, but we don't know what's going to come out of that. So it's important for us to also have those discussions with him to figure out, what direction are they leaning towards as they're doing the study, so that we can strategize and prepare and all be on the same page with what gets introduced. And that's one great thing, honestly, about Chair Pena-Melnick is over the years, she has been very good about bringing together stakeholders to make sure that everyone is in agreement on what bill goes forward. She typically doesn't pass bills where not all of the key stakeholders are on the same page. So I think that's a good ally for us to have in bringing this all together, is that we'll be able to be in the know on what the state thinks about any proposal that we come up with and what they're planning to do on their end. So that said, yes, we have that subcommittee now, and we'll send out the info on that subcommittee by email as well, so that anybody who'd like to join can join that subcommittee. It is going to be more like a work group subcommittee, because we'll be working on creating this financing plan, and potentially, I think part of that will also be doing some research on what other states are doing. I know David has done a lot of that, but there's also some other research that I know we'd want to do on, what's happening in hospital settings, what's changed with CMS, and all these other pieces to consider. So look at our agenda. I think that's everything we had on our list. David, is there anything else that we need to touch base on today?
I can't think of anything. I think we have a lot of next steps on a lot of things that we need to learn in the near term. So yeah, I guess we'll start reporting back on some of these questions once we start digging into them.
Okay. And as always, David is always looking to connect with more community health workers to have to provide a warm introduction to the coalition. So if you know anybody that's interested in joining, is on the fence about joining, please feel free to connect them to David so that he can meet with them, answer any questions they have, and also share some of this coalition swag that we have. Yeah, and I talked today, I met someone at a presentation this morning who's part of, what was he part? I think she was part of Johns Hopkins, but part of some group where it's CHWs who are working with patients that have HIV or AIDS, and they have a workforce there. And something that's happening is that the Ryan White funding that I'm sure a lot of the providers on this line probably know what the Ryan White funding is, but it supports it's federal funding that supports providers in being able to provide different services to people who have HIV or AIDS diagnosis. And so they were talking about how there's been a 70% cut to that funding, which also meant a cut to community health workers working with patients that their work was funded through that. So that'd be an interesting group to reach out to as well. And David, I'll connect you with her. Just wanted to let folks know that's another thing that sounds like has happened and has impacted the workforce. And oh, thank you for sharing that, Monica. And I was also going to ask, well, I'll ask offline for the upcoming Central Soul Conference. Oh, did you want to share with the group about the conference?
Yes, absolutely. Thank you. I thought I already shared with everyone, but maybe I didn't. So sorry. So on May 13th, Centro Sol is hosting the almost annual conference. Every year we have different topic related to pressing issues, public health issues that are affected the Latino population in Baltimore and in Maryland, and sometimes nationally. This year, the conference, of course, is around community health workers. And what we would like to discuss during that conference is a little bit of more of this funding and sustainability of the community health worker workforce, with a tweak of working with immigrant community health workers, Latina community health workers that work in Latino immigrant populations. So a lot of these conversations definitely apply and connect to that discussion in the conference. It's May 13th at noon until 8 p.m. The reason that we extended until 8 p.m. is because at 5 p.m. we will start a little gathering party for our 10th anniversary. So I've been working here at Centro Sol for 10 years. And it's my 10th anniversary at Hopkins and 10th anniversary of Centro Sol and 10th anniversary of us here. So you're all invited. The conference is free. This year, we're not offering CEUs. Sometimes we have offered CEUs and people, and we don't get as many registrations for CEUs anyways. And for those of you who have worked with CEUs, will probably know that those are very expensive to purchase for planning purposes. So we're not offering those this time. And thank you to Ashley and Dr. Ibe. They are both participating at the conference too, and I hope you can join us. I'm gonna put the link for registration in the chat. Again, it's free and you're all invited.
Thank you so much for sharing that. And we'll send that link out to the coalition as well, so that folks who weren't here today get a reminder about the conference. Very, very excited. All right. Did anybody else have anything they want to share? Any thoughts, future agenda items, events coming up? All right. Well, I think that means that we're ready to wrap. Our typical meeting time is 1 to 2:15 now. So enjoy the next 15 minutes doing whatever you need to do. And thank you so much, guys. And we'll see you in May for our next coalition meeting. And we'll be in touch in the interim about those subcommittees.
Great, thank you.
All right. Thank you.
Bye,
Bye,
everyone.
everyone.
Thank you. Bye, everyone.